This video focuses on staff-patient ratio. First, we will see the meaning of the term norms. Norms are standards that guide, control, and regulate individuals and communities. To plan sufficient nursing manpower, we have to follow some norms. There are some factors that affect nurse-patient ratio in a unit or hospital. These factors are patient census, that is the number of patients in the unit; patient acuity, that is the level of dependency or seriousness of patient illness; hospital staffing policies; the unit workload; the skill mix, that is the category of personnel required to work in the unit; available proportion of nurses, productive and non-productive activities, that is availability of or the number of nursing and non-nursing activities to be performed by the nurses; then variation in time, that is the number of shift, whether it is 2 shift, 3 shift or 4 shift; then the nursing care activities that are performed in the unit during a particular shift. Here we will see the different staffing norms given in the Indian systems. Nursing staffing norms given by statutory or accreditation bodies, then various Indian committees, and finally we will compare Indian nursing staffing norms with the international nurse norms. First we will see what are the Indian committees that have provided recommendations about nurse-patient ratio. It includes Bohr Committee, that is 1946, Chetty Committee 1954, Bajaj Committee 1986, High Power Committee 1987, and Cadre Review Committee in 1988. About the recommendation of Bohr Committee, this is the first committee that has taken some initiative to improve nursing standard in India. It is also called Health Survey and Development Committee. They proposed 1 nurse to 500 population. Bohr Committee recommended 1 nurse to 500 population. Next, the staff-patient ratio as per Chetty Committee. It recommended the minimum nurse-patient ratio of 1:3 in teaching hospital and 1:5 in non-teaching or general hospital. The teaching hospital nurse-patient ratio 1:3 and non-teaching hospital 1:5 as per Shetty Committee. The third committee is Bajaj Committee in the year 1986. The staff-patient ratio include nursing superintendent for 1:200 bed, deputy nursing superintendent 1 for 300 bed, assistant nursing superintendent 7 for 1000 bed plus 1 additional for every 1000 bed. Nursing sisters or head nurses or ward in charges 8 for 200 bed plus 30% leave reserve. Coming to the staff nurse recommendation by the same committee, staff nurses for wards 1:3 or 1:9 for each shift plus 30% leave reserve. Staff nurses for ICU 1:1 or 1:3 for each shift plus 30% leave reserve. Nurses for OPD and emergency 1:100 patients plus 30% leave reserve. For specialized units such as OT labor room, there must be 8 nurses for 200 beds plus 30% leave reserve. 30% leave reserve in case the assigned staff are on leave, they must be provided with a sufficient supply. So 30% leave reserve has to be maintained. Coming to the recommendation by High Power Committee in 1987, nursing superintendent 1 for 200 beds. Hospitals with more than 200 beds, there must be deputy nursing superintendent in the ratio 1 for 300 beds. Then assistant nursing superintendent 1 for 150 beds. Nursing sisters or head nurses 1:25 beds plus 30% leave reserve in case if the required staff is taken leave. Coming to the ratio of staff nurses to patient, in the ward there must be 1:3 or 1:9 for each shift plus 30% leave reserve. ICU 1:10 or 1:3 for each shift plus 30% leave reserve. OPD and emergency 1:100 patients For specialized departments like OT, labor room, 1 is to 25. All these areas must be provided with a 30% leave reserve in case the provided staff takes leave. Next about recommendation by Cadre Review Committee in 1988. It recommended a staffing norms for 500-bed hospital as follows. There must be Nursing Superintendent 1, Deputy Nursing Superintendent 1, ANS 9, Nursing Sisters 54 and Staff Nurses 270 for a 500-bedded hospital. Now we will see the recommendations given by statutory or accrediting body in India. It include Indian Nursing Council, Medical Council of India, Staff Inspection Unit and NABH. Indian Nursing Council gave its recommendation in 1985, Medical Council of India in 1990, Staff Inspection Unit or SIU norms were in 1991-1992 and lately NABH in 2005. According to Indian Nursing Council, there must be Chief Nursing Officer 1 for 500 bed, Nursing Superintendent 1 for 400 bed, Deputy Nursing Superintendent 1 for 300 bed and 1 additional for every 200 bed. ANS 1 for 100 to 150 bed or 1 for 3 to 4 wards. Nursing Sisters 1 for 25 to 30 bed or per ward plus 30% leave reserve. Coming to the ratio of staff nurses to patients or bed, 1 is to 3 in teaching and 1 is to 5 in non-teaching. In ICU, 1 is to 1 plus 30% leave reserve. For OPD and emergency, 1 is to 100. For specialized department like OT, labor room, 1 is to 25. In all the department, there must be 30% leave reserve to provide adequate supply. Then 1 infection control nurse for 250 bed. There must be extra nursing staff for conducting departmental research work. This is about recommendation by IN. Coming to recommendation of Medical Council of India in 1990. For teaching hospital of 150 bed, there must be Nursing Superintendent 1, Deputy Nursing Superintendent 1, ANS 02 or for every additional 50 bed, there must be one more ANS. For wards, Deputy Nursing Superintendent or ANS in the ratio 1 for 34 wards. Nursing Sister 1 for each shift or ward. Staff nurses 1:3 provided for 24 hours. For specialized or critical care unit and special wards such as eye and ENT, there must be Deputy Superintendent or ANS 1 for 3 to 4 unit, Nursing Sister 1 per shift and staff nurses in the ratio 1:1. For OT, INC recommends that DNS or ANS 1 for 4 to 5 operating room, Nursing Sister 1 per shift, staff nurses 3 per table. For minor OT, 1 for every 13 patients. For casualty and emergency, Deputy Nurse Superintendent or ANS 1 for each shift, Nursing Sister 1 per shift, staff nurses 2 to 3 staff nurses and it depends upon number of beds in casualty. Coming to outpatient department staff ratio, for surgical, orthopedic, dental and ENT, there must be 1 staff nurse for every 120 patients. For medical OPD, there must be 1 staff nurse for every 140 patients. For gynec OPD, 1 for 35 patients. Pediatric OPD, 1 for 85 patients. Skin, 1 for 100 patients. Then a staff nurse for 86 patients in the injection room and eye OPD. In addition to the mentioned ratio, there must be 30% leave reserve in all categories of nurses to provide adequate supply in case of leave. Coming to staffing norms given by Staff Inspection Unit or SIU norms. Chief Nursing Officer 1 for 500 bed, Nursing Superintendent 1 for 250 bed, then DNS ANS ratio is 1:7.5. ANS nursing sister or head nurse ratio is 1:4.5 and head nurse to staff nurse ratio is 1:3.6. About staff nurse bed ratio according to SIU norms, general ward 1:6, special ward 1:4, ICU 1:1, nursery unit 1:2, major OT 2 per table and minor OT 1 per table. Coming to main casualty, where there is a turnover of 100 patients per day, nursing sisters must be available 3 for 24 hours. Then 1:1 staff patient ratio in a shift plus 1:35 for every additional 35 patients. In burns unit, that is up to 15 patients per day, there must be 3 staff nurses or nursing sisters for 24 hours. Then 1:1 staff nurse patient per shift and 1:10 for every additional 10 patients. In orthopedics, where there is 45 patients per day, 3 nursing sisters for 24 hours, staff nurse patient 1:1 per shift and 1 for every additional 15 patients. Gynec or obstetric ward up to 40 patients per day, 3 nursing sisters, 1 per shift for 24 hours, 1:1 staff patient per shift and 1:15 for every additional 15 patients. For OPD, 1:3 staff nurses, injection room 1 staff nurse for 100 patients, 2 for 120 to 220 patients and 3 for 221 to 320 patients and 4 for 321 to 420 patients per day. Then it also recommended 45% additional staff for leave reserve. Lastly, about NABH recommendation in 2005. NABH is nothing but National Accreditation Board of Hospitals. ICU 1:1 for ventilated bed. If non-ventilated bed, the ratio is 1:2, that is in each shift. In high dependency unit, 1:3 in each shift. For inpatient ward or bed, there must be 1:6 per shift. For OT, 2 nurses per table in each shift. In emergency department, 1:1 staff patient ratio for ventilated bed and 1:4 for other non-ventilated bed or other normal bed. It must be per shift. For OPD or other various procedures department, there must be as per the workload. Then for labor room, 1 nurse per table in each shift. There must be infection control nurse 1 for 100 beds. Supervisory staff must be available as per the demand. Now we will see some of the international recommendations. First about the USA staffing norms. They provide intensive or critical area nurse patient ratio in 1:2, pediatric department 1:4, neonatal intensive care 1:2, emergency 1:4, operating room 1:1, post anesthesia unit 1:2, and in trauma patients ER 1:1. Also, in the antepartum ward or in the antenatal ward 1:4, labor and delivery ward 1:2, postpartum mother and baby 1:4, postpartum women only 1:6, medical surgical ward 1:5, other specialty care 1:4, and psychiatric unit 1:6. About the staffing norms in Canada, general medical ward 1:4, surgical ward 1:3, combined medical surgical unit 1:3, pediatric 1:2, adult ICU 1:1, palliative nursing unit 1:3, obstetric nursing unit 1:3, mental health and addiction services 1:4. So far we have seen various Indian norms that recommend staff-patient ratio. Also, we have compared Indian systems with the international staffing norms. Here we will see a consolidated recommendation as per the Indian norms, international norms and latest research evidences that has to be practiced ideally. This table has 2 columns. One column represents the different units or ward. The other describes the ideal ratio in each unit or ward. Coming to general ward, the ideal ratio is 1:6, that is 1 staff nurse for 6 bed or 6 patient. In a super specialty unit, the ideal ratio 1:4. High dependency units, there must be staff patient ratio in 1:3. ICU and post recovery units 1:1 for ventilator bed and 1:2 for non-ventilator bed is the ideal. In emergency and trauma care sector, 1:1 and 1:2 for ventilator and non-ventilator bed respectively. In labor room, there must be 2 nurses available for 1 table. In antenatal or postnatal ward, there must be 1 staff nurse to care for 4 patients. In pediatric ward, 1:5. Neonatal ICU, there must be 1:1 nurse patient ratio. In acute respiratory or burns unit, 1:2. Palliative care units, 1:4. Major OT, 2 nurses must be available for each table. In minor OT, 1:1. Chemotherapy or daycare unit, 1 nurse for 3 patients. OPD or procedure room, 1:1. And OPD, 1 nurse for 50 patients. There must be 1 infection control nurse for every 100 beds. Additionally, 10 to 15 nurses should be available to perform the duty as nurse educator, wound care nurse, stoma nurse, dialysis nurse, organ transplant coordinator, PICC line nurse, and nurse research assistants. Additionally, 45% of nurses must be available for leave reserve. This is the consolidated recommendation or summary of nurse-patient ratio, that is staff nurse-patient ratio considering international norms, Indian norms, and best research evidences. Here is the end of this video. Thanks for watching.